Good afternoon, ladies and gentlemen. Welcome to this COVID press briefing. Now, all you're going to hear this afternoon are two voices, myself and those of Dr. Brink, and those of you that can watch us can see that there are only two of us on the panel. There's nothing concerning about that, and I'll address that issue in a moment or two. Now, rumours unfortunately abound. They abound at the best of times, and we're not at the moment, frankly, at the best of times. But I urge against speculation, and this is a general comment. If there is bad news, we will tell you. If there is good news, we will tell you. We will tell you the news. There's no intent at all to be anything other than open with the public of the bailiwick. Now, some of you, as I say, have seen that the usual members of the panel are not here. That's not of any concern, but in recent days, they've been made aware that they may be contacts, or in the case, or even contacts of a contact of a case. In other words, there is just a possibility that there could be something to look at. So on a risk assessment carried out by Dr. Brink, myself and the other members of the CCA who are normally here, it's been decided, in line with Dr. Brink's advice, that those CCA colleagues and senior officers are observing passive follow-up measures as a precaution. Now also we want to make sure that we're all not in the same place at the same time should something happen. Nothing has happened, but just in case. So these are sensible business continuity procedures and measures that we put in for the moment. Now, we're not going to go into more detail than that because simply there is no more detail to give you. And Dr. Brink and I, we know that we are not in that position, but as you can see, we're now well socially distanced. We're probably socially distanced by a multiple of about 3 or 4, and we're in a room which is well aired and is suitable for this kind of broadcast. Now, we're also taking steps, if necessary or if appropriate, to have virtual press briefings thereafter. What we didn't want to do, because we've delayed this press briefing by, 3.5 hours or so, is to delay it further. We thought it was important that it continue, and it continue in this forum, which is entirely safe. Now, I talked earlier about rumours. Now, there is a serious point to that. We live in a decent society. We don't have a lynch mob mentality. But we've heard and seen of some very unpleasant rumours today. They're unacceptable. To name individuals and to show photographs and claiming that he, she or they did this, that or the other is simply not right, not accurate and not decent. And will people please stop doing it? Unless you're a public health or law enforcement officer, do not pretend that you have all the facts when you simply do not. Now, I'm not just speaking as a politician, but I've been a lawyer for many years, and rumours I've found are nearly always wrong or exaggerated. So please pay no heed to them. We will tell you the facts. You're affecting the lives in a very material, bad way of real people. The head of law enforcement has confirmed to us just very recently that no arrests have been made in relation to this lockdown. Now, turning to other more practical matters, I want to update you on our schools. As you know, for the last couple of days, all our schools and colleges have been closed. They will continue to be closed, generally for most of the population, but for the rest of the week for vulnerable students and children of key workers for this week. We will be reviewing that later in the week to see if that continues beyond this week. So we don't know yet if it will be possible for those children specifically to be on site next week. That depends on what happens over the forthcoming days. Now, we fully appreciate, of course, that's going to be difficult, in some cases very difficult for parents, children and employers trying to run essential services. We sympathise with them, but they, being intelligent and reasonable people, will also realise that we haven't made this decision lightly. Our overwhelming objective is to prioritise all our efforts in the following days and weeks in preventing further spread of the virus. Dr. Brink will elaborate you shortly on what we're saying in terms of cases and our thinking around the schools. Now, I also have a decision to announce relating to travel from Guernsey to Sark and Alderney. From today, anybody making such a journey will have to self-isolate for 14 days when they arrive in one of those smaller islands. That doesn't change the requirements for travel outside of the bailiwick. This relates specifically to those travelling only from Guernsey to Sark or Alderney. It's not applied to those travelling in the other direction. This is to protect those communities. They're small communities. They don't have the same depth of health services and infrastructure that we have living on Guernsey. So we want to protect them, and that decision is wholly in accord with the wishes of those communities. Now, those islands, Alderney and Sark, are working quickly to address some practical issues, such as whether certain key workers, essential workers, will be exempt from those requirements. And those details will follow as soon as they are available. But the 14-day self-isolation rule applies immediately and from today. Now, of course, this pandemic has caused financial havoc for lots of people and sadly will continue to do so. But I want to update you in relation to some of the financial support measures. I and my colleagues on Policy and Resources met today and have agreed to bring back the Hardship Fund for individuals who need urgent financial assistance and are not eligible for other benefit support. It's also been agreed to reintroduce the payroll co-funding scheme for all the sectors who were eligible at the start of the first lockdown. This will be set at 80% of minimum pay, which is £8.70 an hour, capped at 42 hours a week. The employers will be required to make up the additional 20%. We're putting arrangements in place now, and the plan is that we will begin taking applications from the beginning of February for claims this week. From then on, payments will be made on a monthly basis. This is based on our hope that the lockdown will be short, but obviously we will review and make changes as we go forward if needed. The scheme will be open to the self-employed and sole traders. We will publish details of how to get such help from both the payroll scheme and the hardship fund today. One difference on the payroll co-funding scheme is that we're asking businesses to think very hard about whether they really need this support. We know a lot of businesses thankfully bounced back very well after the last lockdown, which is great. We hope that will happen after this lockdown. But please, if you can cope without help, and if you expect to bounce back well after the lockdown, consider if you really need to make a claim. We need to direct public finances, which are under strain where they're most needed. And of course, you can appreciate that the strain on the finances, is both from the last lockdown, which we haven't fully recovered from, and going forward will be enormous. We're also including a clause in the scheme so that where businesses find they make a profit over the course of the year, we will be able to ask for payroll co-funding to be returned. It remains our intention to publish information about businesses who receive such support. Now, Dr. Bring will update you on where we are with cases and where we are in relation to the schools.
Thank you very much, Deputy Fairbrush, and our apologies for keeping you waiting this afternoon. So what I'm going to focus on today is not to give you a general update of the number of cases we've had right from the beginning, but to focus on the recent cluster, because I think that's what you're probably most interested in. Now, I think you're all aware that it started on Friday the 22nd with the identification of 4 cases of unknown community seeding. So these were cases which we identified that had no clear link to either a contact or to travel. So that was a really significant finding for us, and that led us to go into lockdown. On Saturday the 23rd, we identified another 6 cases, and of those 6 were identified then as contacts, and you can see the efficacy of the contact tracing process starting to kick in, and there was a further 1 unknown community source. On Saturday the 24th, we had ramped up all of our testing. We were getting a lot more people in. We were doing a combination of contact tracing, identifying areas of interest, but also what we call source tracing as well, where we look at a venue of interest and do some broader testing. And on Sunday the 24th, we detected a total of 38 cases. And you can see the majority of those 34 were in fact contacts. So we'd identified them through our contact tracing processes. And 3 were from an unknown community source and 1 was from travel. Going into Monday, we detected 10 cases yesterday. 7 of those were contacts, 3 were an unknown community source. And I need to add here that what will happen over time is that we may change the attribution slightly. So in the first instance, if we're not sure, we'll put the case as an unknown community source. As we then go through the contact tracing process, we might then find a link and we might move it to a contact. So if these numbers change, it's just because we've managed to get further information. So to date, today we've had 13 cases as of 4 o'clock this afternoon. And of those 13 cases, 1 was a traveller, 6 were community cases, and 6 were identified through contact tracing. Now, what we find as we start taking cases off, the 6 that are that we've classified as community cases may well end up being contacts, but we just haven't done the full investigation yet. So we're continuing to see cases, and we're likely to see more in days to come, and I think it's really important that we prepare and be ready for this. So the other thing that I've tried to look at in more detail is what's going on in the educational settings. And as of last night, and I haven't done a situation report this evening yet, is as of 7:30 last night, we had a total of 30 cases that were linked to either a school, college, or some sort of educational setting. So really important that it was across 8 different educational settings, from preschool nurseries up to secondary schools. And this involved a total of 17 pupils and 13 either staff or household contacts. So as we identify cases, we'll then go back and look at household contacts, we'll look at staff, we'll look at year groups. So we start working out and trying to look at exactly what the magnitude of the problem is. So that gives you an overview of what's happening in the educational settings. Now, I can't remember which one of you asked me, it was a bit about symptomatic versus asymptomatic testing. And so I had a look at that ahead of this press conference. And if you look at the people that have gone through our testing tent, and these are just the ones that have gone through the testing tent, not the ones who've been tested through primary care. On Sunday, the 24th of January, we did 644 tests through our testing tent, and there was roughly an even divide between symptomatics and contacts of cases. So the contacts of cases were people that we were identifying through the day, through our contact tracing process, calling them in to be tested, and about half of them were symptomatic. So again, we've put the call out to islanders, if you do have symptoms, come forward and be tested. The 55 those form part of our surveillance programs, people that we're testing for various reasons. Preoperative, hospital admissions, so all of those fall into that group of individuals. On Monday, we saw a similar number of tests, 677 tests, and again, we saw a roughly even divide, perhaps slightly more identified through contacts of cases. And again, all of those people we'd identified as people of interest, we're calling them and bringing them in to be tested. And the symptomatics, we're seeing a lot of symptomatics, and that's good. We want people with symptoms to come forward and be tested. We really encourage that, because that enables us to identify any cases that might be in the community. And 97 again, that goes to our surveillance, our hospital admissions, pre-giving birth. So all of those things are part of our testing policies. So that gives you an idea of what we're seeing through the scheduling tent. There are more symptomatic patients going to their GP and being tested through that, so that doesn't represent all of the cases that are being tested. So on from something slightly different and very encouraging is our vaccine statistics. Now, as I spoke last time, is we opened the community vaccination centre at Beausejour early, and that was simply logistical in that we didn't want to take people up to our mini vaccine hub at the PEH. We thought it was safer to bring them down here, but we didn't want to pause the programme in any way, shape or form. We wanted to go on seamlessly. So over in the first weekend, or the first day of the community vaccination centre, we delivered 365 vaccines in the centre. And over the weekend, we carried on. We did 352 in the age 75 over, 13 in the priority group 2. So we're moving on the whole time. And these represent all of the cases that we're giving vaccination to. And that's, again, really encouraging. I also wanted to talk a little bit about self-isolation, because it's something that we've seen quite a lot of in our inbox, and I wanted to try and define some of the things, so make it absolutely clear to islanders what we mean. So if you're a close contact of a case of COVID-19 and you'll be identified as a close contact by Public Health Services, you must isolate for 14 days. So if you're phoned up and someone says you're a close contact of a case, you need to isolate for 14 days. And as I said, that person will have been identified through Public Health Services. Now, the other thing that we're doing at the moment is what we call cohort testing. So this is when we identify a case and go back and test a large cohort of individuals to see if there are any other cases in that cohort. So when we do cohort testing, if someone is tested and they're negative, they're then are free to move from self-isolation to normal lockdown rules. So that's really important. But it can get confusing because someone in that cohort, as we move through the contact tracing program, we might then identify as a true contact of a case. So we might then go back to them and say, You were released on cohort testing, but we've now done further investigation. We think you're a contact, and therefore you need to do 14 days. And I know it's complex, I know it can sound confusing, but it's really important that we follow these rules, because this is the way we'll get on top of the pandemic, on top of the clusters that we've got. So I think that's important that we clarify that for islanders. So there are a number of other things that have come to fore. The first is that we identified another case in the Ship and Crown, and we identified that on Friday the 22nd of January. So what we're now asking is anyone who's symptomatic and has been to the Ship and Crown or the Crow's Nest between Monday the 18th of January and Friday the 26th of January to come forward if you have symptoms. So we want to focus our testing capacity on symptomatic people, because they're the people that are most likely to transmit, but they're also the people that are most likely to be positive. So we're not asking everyone who's been to the Ship and Crown between the 18th and the 22nd. What we're asking now is only those who are symptomatic to come forward for testing. Now that's really important, because what we want to do is focus our testing capacity not only on symptomatics, but also on other vulnerable settings, so increased surveillance, for example, in our hospital setting. So really important. I also want to talk a little bit about symptoms. So if you do have symptoms, please either see your GP in primary care or alternatively phone the clinical helpline. But if you have a non-clinical query, so you don't have symptoms but you want to get other information, please phone the non-clinical helpline. So we've got the clinical helpline and the non-clinical helpline, and if you phone the right one, if you've got symptoms that's clinical, otherwise phone the non-clinical helpline for some more general information. I'd also like to, at this stage, encourage islanders, if they do have urgent medical problems, we are open for business. Please do contact your doctor in primary care, your GP, or if you're seeing someone at the medical specialist group, please do contact them for further advice. We'd like to ask islanders not to delay urgent care. We don't want people to store up problems for the future. I think that's really important. So for urgent problems, please do contact your relevant healthcare practitioner. And the final thing I'm going to do is end up on a more optimistic note, in that we have approved the Moderna vaccine for use in the bailiwick, so it'll be our third designated vaccine now. We're not expecting immediate availability of the vaccine. We're anticipating getting deliveries round about spring, but it's nice to be it'll be nice to have a third designated vaccine available for our use. And thank you, Deputy Fairbrass.
Dr. Brigg, just again to emphasise firstly that I just want to emphasise, because it is important for parents, all schools, all early year providers will be closed, as I say, will remain closed, both for the two types of students that would otherwise go there. And there's one final thing that I want to say before I ask you to ask your questions, members of the media. It's a message to a small number of businesses that we've observed who seem not to be adhering strictly to the lockdown rules. Now, if you can work from home, the rule is you must work from home. Outside of that, businesses should follow guidance which is given online and will be updated as is appropriate, which includes who is considered to be an essential business or worker and what is an essential retailer. Now, I'm sure most people and most of those businesses know if they're really essential. If you're not, do not try and get around the rules. They will be strictly enforced. If people adhere to the rules and keep to the rules, then the sooner we can get out of this lockdown, the better, and we're more likely to be out of it sooner rather than later if people agree and follow the rules. So thank you very much. Members of the media, your question. Yes.
I know you're obviously having to build a bit of a broader picture at this stage. Are we still thinking the 4 cases that were first identified were the first people to possibly catch it, of the people you've identified? And do you know when you think they might have caught it based on where their symptoms are? As in when?
Okay. So first of all, relying on symptom onset, there's such a huge variation. Some people can be symptomatic on day 2, 3. Some people can become symptomatic later. So the median time for symptoms is between 5 and 7 days. So it is difficult for us to know with any degree of certainty. So what we're managing to do is link some of the cases, and we've been quite successful. We've linked quite a lot of the cases together. What we haven't managed to do is go back. There's no obvious source of how those 4 cases were infected. So we're cross-linking at the moment between cases, and what will happen is as we carry on doing that, hopefully eventually we'll find a source. But that doesn't always happen. I think the important thing is to be proactive and look forward. We want to flatten, suppress this virus again so that we get into the enviable position that we were in before.
Next question, please. Yes.
Hamish Alscray from ITV Channel. The 3 cases in hospital, were they people who were admitted to hospital because of COVID symptoms, or did they catch it in the hospital?
They were admitted because of COVID. They're admitted because of COVID symptoms. We haven't had any patients catch COVID in the hospital.
How seriously ill are the people in?
I'm not going to comment on
No.
individual cases. I really can't, and I will always respect our patients' confidentiality, and I think that's so important, particularly in a small community, because anything you say, you can easily identify someone, and we need to put our patients front and centre at everything we do.
Any other questions for anybody?
You mentioned about how many people you've been vaccinating over the weekend. It sounds like it's been phenomenally busy. I think when we chatted last week, you said you hoped to reach up to 300 vaccines a day, and it sounds like you might have been surpassing that over the weekend. How busy has it been?
So what I'm so proud of the team. The vaccine wastage yesterday was 0. They are doing phenomenally well. So if they see that someone's ill or cancelled an appointment, they have a list of people that they'll go and they'll phone and say, well, we've got a spare dose, can you come in? So it's that discretionary effort, that huge discretionary effort that has been absolutely phenomenal in the vaccine team. And our wastage is, when I last looked at it, was less than 1%.
Any other questions? I don't see. Yes, sorry, I didn't see you.
One for Dr. Brink. Do you have any idea of how many awaiting tests you have and whether you have enough capacity to keep up with demand?
So, yes, we have enough capacity to keep up with demand. One of the problems with our waiting tests, it is a phenomenon. So what happens is we result up to 12 o'clock at night, which is why our statistics go from 12 to 12. But we continue testing overnight. So all of those ones that we've got testing overnight will then appear as awaiting results. But actually, if you look at us, if we took the statistics from 9, 10 in the morning, that number goes down. So the awaiting results for us, because we test overnight, is sometimes not an accurate reflection of the true situation. With regard to reagents, I presume is what you're asking, yes, we've got enough reagents, so we've checked on that. With regard to laboratory capacity, yes, they're working really hard. The scheduling tent are working really hard. But again, what we've done in Guernsey is we've always had this very flexible approach. So, for example, the scientists that work at the States Analytical Laboratory are trained in molecular techniques. So they will come up and help the diagnostic service. So it really is Team Guernsey. And that, I think, is what's made it so successful as we move forward.
Yeah. Yes.
I know it comes to vaccines, we're very much reliant on what we get from the UK, but I'm sure as you've been reading today in the news, there's quite a lot of pressure currently in Europe on people trying to get hold of the vaccine.
Yeah.
I mean, how worried are you about shortages?
I think that's one of the advantages of being linked into the UK supply chain. So we get a proportionate allocation of the UK supply chain, and so we get 0.1%. And obviously, they're a much more powerful purchaser than we are on our side. So that's why we made the decision in the beginning, is to link in with the UK supply chain, because that gives us a greater degree of security. Are we worried? Of course we're worried. I mean, we really want to make sure that we get our vaccine allocation. But to date, we've received our 0.1%, and we're getting more or less what we expected to get. But we can never be complacent, and we continually, on a weekly basis, remodel our vaccination program, because we have to look at vaccine 1, vaccine 2, make sure that we've got the right supplies at both times, because you've got to have the same type of vaccine twice. So we're continually looking at it. So I would say that we're aware of potential shortages. We plan for potential shortages, but being linked into the UK supply chain, and we're enormously grateful for that, is very helpful to us.
Yes.
With the overall case number, not massively higher than yesterday, only 10 more, does that represent a better situation than you thought we'd be in today, given the 4 unexplained cases on Friday evening?
I'm pleased we haven't had an exponential increase. However, we cannot be complacent. We are still seeing, for us, a large number of cases coming through. I understand that other jurisdictions might not think it's such a lot, but for us it is a large number of cases coming through. We are still seeing cases of unexplained community transmission. We're still in an unstable situation. If you look at what happened in the first lockdown, when we mapped it out, we started seeing that effect about 10 days after lockdown. Bearing in mind the incubation period of the virus from 2 to 14 days, you started seeing the cases come down. But really, really important that we're cognizant of the fact that we're not out of the woods, and we need to continue with the lockdown. We need to continue to follow the rules, and continue to monitor the situation.
I've been reading your detailed advice online about when and where to wear masks. I believe from reading it, you ideally are encouraging people to wear it even when they're going out for their 2 hours exercise. Is that correct?
With that, I think you can have a degree of discretion. So if you're walking by yourself on the cliffs with no one else, I think it's reasonable not to have your mask on, but if you come near anyone, you need to have your mask available and be prepared to put it on. So what I've always felt about masks, and indeed about a lot of our advice, is islanders need to use their common sense, and we've been very good at it to date. So if someone was going on a lone cliff walk for their hour of exercise by themselves, in the rain and wind, to have a mask on is going to be incredibly difficult, and actually probably more of a hazard than anything else. So I think that's really important. But I think if you look at mask wearing, you're looking at absolutely in enclosed spaces. You're looking at absolutely when you can't socially distance. So when you go to the supermarket, when you go to other shops, you've got to have your masks on, and those type of places. So it's when you're close to people, because it's a protection for the people around you.
I can just continue on with a slightly further question. I think a lot of people have been out there walking, and obviously when they come across someone on the pavement, I've seen people going 2 metres away into the road and keeping away. In those sorts of situations, is it okay for people not to wear a mask, because obviously they are keeping distance?
I think if you're walking in an urbanised area where there are other people walking, you should wear a mask. If you're walking by yourself in a deserted place with no one, I think it's reasonable not to. One of the things, if you're walking in an urbanised area, to sort of pop your mask on, pop your mask off, you should. We all know the rules for mask wearing. Sanitise your hands, put your mask on. When you take it off carefully, and so on. Sanitise your hands afterwards. You're not going to be able to do that if you're putting it on and off in an urban area.
Any other questions, Raymond?
There has been some debate over the democratic accountability for the decisions made, obviously, very quickly over the weekend. Yep. Can you reassure members of the states and your fellow deputies that they'll get a chance to debate this next week?
They will. The Civil Contingency Law of 2012 was meant to deal with, and is dealing with, an emergency. Undoubtedly, this is an emergency. Of course, everybody's accountable, and states members have the right to be listened to and for their representation to be made. So that's not a difficulty.
Is there a date set for the next virtual state sitting?
The next states meeting, it had to be postponed this week because the rules which permitted virtual states meetings were rescinded when the previous lockdown came. And also we've got 17, 18, I can't remember the exact number of new states members. And it is a different skill. It's a different, it was brand new to me when I had to, and I'm used to speaking in public forum, when I had to deal with it by way of virtual states meetings on the last occasion. So the early part of next week, whether it's Monday or Tuesday, we're looking to as early part of next week as possible. Anybody else? I don't see so, and I don't want to... Oh, yes, sorry, Aaron. Yep.
Just one more about education, if you can.
Yep.
Distance learning, and we've had some contact from parents who said that they haven't been given anything to actually begin with their homeschooling. When will that come into place?
I can't tell you precisely, but I know the education authorities are doing their best. But because, of course, this is a unique situation, not only are the schools closed to every other child, they're also closed to the two categories that otherwise were going to school. So the teachers, the education staff are doing their absolute best, but I can't tell you it'll be tomorrow or the day after, just it'll be as soon as is possible. Yes.
Dr. Brink, are we still clear of cases in care homes? Because I know that's what you said over the weekend. Is that still the case?
So what was the question to Dr. Brink about care homes?
To ask whether or not there's still free of COVID in care homes.
Yes, and I answered yes.
Yeah.
Yeah, okay. Very brief answer, very good question.
That's fine. It's good news.
In care home settings and other such kind of scenarios, are the people in charge of those homes being given information before the rest of the public about potential cases and to protect their staff and protect their residents?
So there's a care home cell, a care and residential home cell, who provides specific advice to care and residential homes. And with regard to other patients, in other settings, no, because we wouldn't provide information about patients in one setting to patients and to people in another setting, because that would breach people's confidentiality. So care homes are getting the right information for them with regard to what precautions they should be taking and so on, and that's being done through the care and residential home cell.
Anybody else?
Do you have the numbers of people who are now in isolation, or is that data still not?
I will get that data for you. You asked me for it last time, didn't you?
I think my colleague did,
Oh,
but
did
yeah,
you?
that's fine.
Yes,
Yeah.
I'll have a look at that for you.
Thanks.
Anything else, ladies and gentlemen?
There are 3 panel members who aren't here today.
Yep.
And I think the rules or the guidelines around when people should be isolating, despite not being for people who are awaiting a test, seem to be unclear at this stage. What guidelines would you set out for people to help them to know when they should and should not be isolating if they're a potential contact?
So shall I go back to the slide then? So that was the self-isolation slide. So you've got to define, and I agree, there have been queries about this, which is why I brought it up on the slide. So you've got to differentiate between a close contact and someone who's identified as a cohort. So a close contact is a person who's had a significant contact with a case of COVID-19. And for those individuals, they need to self-isolate for 14 days. What is happening also, because we have the bigger testing capacity, and what's different from this wave to the first wave is that we have a very big testing capacity. So what we're doing is we're identifying cohorts of individuals, like, for example, a year group within a school, and we're doing broader testing on that cohort of individuals. Now, they're not all necessary contacts of the case, but they've been in the same environment, so it's an area of interest. So with that cohort testing, if we identify a positive in that cohort, if we test the cohort and do a test on them, is that once they've got a negative result, they can then be released from self-isolation into normal lockdown rules. So that's when you've tested a whole class and you found that whole class negative. All of those negative children can be then released into lockdown rules. Now, over the course of time, as we proceed with our investigations, some of those members of that cohort might in fact become a contact. You might then find out that they've mixed at a certain function, at a certain sports event, and they'll change then from a cohort member to a contact, and then they might go into 14 days of isolation. And I know this is complex to look at overall, but what we try and do is, for specific individuals, when we speak to them about their results, tell them exactly what their requirements are. So if someone is tested as part of a large group without a specific known contact, they're tested as a cohort, they will stay in isolation until they get the negative result, and then they'll be released into lockdown rules. If they're identified as a contact of a case, they'll do the 14 days. Does that answer your question?
Yes, thank you.
Anybody else? I don't see any other hand raised, so I'm grateful again to the press for their perceptive and helpful questions, because that does help inform the public. I'd want to borrow a word of Dr. Brink's and one of my own. Her word is complacency and mine is vigilant. If we're not complacent, if we are vigilant, we've got more chance of getting out of this lockdown sooner rather than later. And again, to use a phrase she used, common sense. If people use their common sense, then this problem can be behind us quicker than it otherwise would. I'm very grateful to the people listening and watching, and I'm very grateful to the media. Thank you very much.